When I was in my 20s, I was in the best shape of my life. I was working out 4 to 5 days a week, lifting weights, running, and playing intramurals. Working out was my life. But one day at the gym, I reached for a weight from the ground, and like a lightning bolt, I felt this sharp shooting sensation from the middle of my low back down the back of my leg. It brought me to the ground, gasping for air. And for a second, I was worried I wouldn't be able to get up. As I lay there, trying to catch my breath and hoping the pain would dissipate, I realized I had never experienced anything like this. Only the occasional sore muscle, but this was different. And immediately the fear set in. I managed to crawl my way to a bench and I sat there trying to self-assess the damage. I eventually waddled my way out of the gym into my car, where I drove home in complete agony. I figured I could rest it, give it a few days, and then things would be back to normal. But as I had feared, and against my hopes, my injury did not improve. I had really messed things up. Sitting was unbearable. Lying flat on my back to sleep was even worse. I tried to stand as much as possible, but it wasn't long until that started to send shooting pains down the back of my leg and into my foot. I could hardly find relief with the basics like heat, rest, and ibuprofen. So I went to the most knowledgeable resource at hand, Google. Google informed me that I had herniated a disc in my back and would need to see a doctor. If it was bad enough, I might even need surgery. So I scheduled an appointment with my primary care provider. And by the time I got in to see him at the end of the week, I had started feeling a bit better, but was extremely worried about returning to lifting or working out. I was also worried about how I was going to get through the rest of my semester when I could barely sit for more than a few minutes and standing was only tolerable in short stints. I told my doctor about how I had been lifting weights when I experienced excruciating back pain and how I was concerned about a herniated disc. My doctor advised me to stay away from the heavy weights until my back was feeling better, gave me a prescription for pain medication and a muscle relaxer to use when necessary, and told me to come back in 8 weeks to reassess how I was doing and decide if I would need any further imaging. And at that moment, I was hopeful, but that hope diminished as quickly as it came. The pain medication helped at first, but after a few days, it wasn't enough to dull the pain in my back. School and work became harder and harder as I was expected to sit for long periods of the day. But after only a few minutes, the pain would creep back and develop into this burning sensation that I couldn't ignore. At least once a week, I had to miss work and leave class early because of the debilitating levels of pain. I stopped exercising altogether because I was terrified of making my back pain worse. After a lifetime of sports and staying active, it felt as if all the muscle and strength I had was disintegrating by the minute. I started to have trouble sleeping, not only because of the discomfort when I lay flat, but also because of the restlessness of being sedentary all day. It was the first time in my life when I wasn't up and moving on a daily basis. And after a few weeks, I returned to the doctor worse than when I had first come in. He recommended I try physical therapy, which helped some. They gave me a few stretches for the back and some exercises to strengthen my core. But once I stopped going, the pain came back with even greater frequency and intensity. My doctor did an MRI, and before you know it, I was at a surgical consult for my back. And then another one, because I wanted a second opinion. I felt hopeless not being able to find relief. I was depressed. I gained more than 25 pounds from when I first injured my back 6 months ago because I wasn't working out anymore. And I was walking a fine line with my work because of all the missed days for doctor's appointments and treatment. My back pain was in control of my life, and I couldn't seem to get my life back. This is the story of a person suffering from chronic low back pain. This story may resonate with some of you, as many people, if not almost everyone hearing this right now, is likely to experience low back pain at some point in their life. Not only that, but 3 out of 4 people with low back pain will not fully recover within a year. And there's about a 75% chance that they will have another episode in the future. And as a result, low back pain has become the #1 cause of disability worldwide. And it's an expensive problem, accumulating over $100 billion a year in healthcare costs, sick days, and decreased productivity. One of the biggest challenges of treating low back pain is the fact that it's multifactorial and many times does not have a specific medical diagnosis. To put this in perspective, imagine you go to the doctor for a sore throat. Your doctor does a quick test for strep and it's positive. You have contracted a bacterial infection and will require antibiotics. But that's not how low back pain works. For those of you who have had low back pain, you know that it can sometimes come on seemingly without cause or reason. You may wake up one morning with a sore back or go to lift something and suddenly find yourself in debilitating pain. We can look at MRIs or X-rays to help identify potential problems, but newer research suggests that imaging like this is often more harmful than helpful. And that's because X-rays and MRIs only make sense if they correspond with the symptoms you're experiencing. For example, a study in the 90s looked at imaging for people with and without low back pain. Surprisingly, they found that about half of the people had abnormal findings on their MRI, but not all of those people had back pain. Some had no back pain whatsoever, and some had normal MRI reports, even though they experienced chronic pain. Without evident rhyme or reason or a reliable way to diagnose, it can be hard to define what exactly is going on. So we slap a label on it and call it non-specific low back pain. Super not helpful when you're trying to find a way to treat and prevent it from coming back. Currently, there are lots of what I would deem as subpar treatments available to manage and treat non-specific low back pain. Depending on what type of healthcare provider you see and their suspicion for the cause of your low back pain, you could receive medications, physical therapy, pain education, surgery, mental health therapy, exercise, and the list goes on. Physical therapy, the profession I currently work in, is where you are likely to find the most common approach to addressing non-specific low back pain, and that's with exercise and movement. What we know about people with low back pain is that they move differently when there is a flare-up of pain compared to when there is no pain. We call these changes in movements impairments, and they can develop because of the way an individual is built, combined with the specific movements needed to perform a task. For example, a very tall individual who needs to pick something up from the ground may move in a way that requires him to bend in the back a lot more than a shorter person who bends at the hips or knees to perform the same movement. Another example is when you reach up overhead to get something off of a shelf. A taller individual likely will have less arching in the back as he reaches up than a shorter individual who will have to reach and extend the back to get to the top shelf. Physical therapists help treat patients with low back pain by addressing the pain with strength and flexibility. The science behind it sounds something like this. You have tight hips, and that's why you're bending too much in your back. So if we stretch the hips and strengthen the back, you'll have less pain. The assumption with this form of treatment, though, is that stretching and strengthening will directly translate to you performing your activities better and with less pain than before. And it works to an extent. We have research to show that people do get a little bit better from general exercise and movement. But those results aren't typically long lasting, hence the frequent recurrence of low back pain. So, what if you looked at the specific tasks that are painful or difficult and taught people how to move better and with less pain? When I was completing my doctorate in physical therapy, I worked with a team of researchers that was studying the movement of people with chronic, non-specific low back pain. They wanted to compare the traditional treatment of low back pain to a new approach where they teach people how to move with less pain. Instead of assuming that strength and flexibility would translate into better movement and less pain, they practiced movements that patients were having difficulty with, and they came up with a strategy for people to perform these activities without pain. This concept is known as motor skill retraining, and it requires practicing the task repetitively in various settings and scenarios so that you can learn how to move without pain. The goal was to provide the least directive feedback and encourage problem solving and learning within the context of each individual person's pain. And instead of having patients perform exercises at home, they were instructed to perform the activities that cause pain, such as unloading the dishwasher, vacuuming, yard work, or sweeping, but in a pain-free manner. And what happened? Patients who practiced the tasks that previously made their back pain worse had better results and longer lasting results than if they completed the traditional strength and flexibility exercises. So, what does this tell us? That simply getting more flexible in your hips and stronger in your core when you're experiencing back pain doesn't directly lead to decreased pain. In fact, pain is more complex than that. There's a saying in the physical therapy and pain science world that pain is generated in the brain, which is true. There's nothing anatomically in the back that is painful. Like a game of telephone, there are signals that get sent from the receptors in the back up the spinal cord and to the brain, where the brain interprets it as pain. These signals can be stronger or weaker, depending on what else is going on in your life. For example, if you're feeling stressed, tired, or if you have developed a fear of specific movements, you likely will have stronger signals and therefore greater instances of pain. So if you injured your back lifting weights and developed an association with weightlifting and low back pain, you may have greater instances of pain when you go to lift an object than you would if you were picking up your backpack from the ground. Even though the mechanics and the motions are similar with those two movements, the brain makes a connection between lifting and pain, which leads to a heightened pain response when attempting the activity. This is why retraining those strategies and finding ways to do things that are painful but without pain is so powerful. You can't simply address the function of the muscles. You must also feel safe when performing the task at hand and know how to move your body without pain. After everything we've learned from the research and clinical practice over the last 50 years, it's no surprise that treating and addressing low back pain is a complex issue. We used to think it was simple, that you could rest and stretch and that it would heal on its own. But now we know that's not the case. Over the last few decades, we've learned that treating low back pain takes a multifaceted approach that includes not only changing the way you move, but changing the way your brain understands pain. But the good news is that the future of managing and treating low back pain is promising. We're no longer prescribing a regimen of rest, ice, painkillers, and 3 to 4 generic stretches. We're treating the individual at hand, and we're teaching you how to move in ways that feel safe and translate into your daily life. This is how we will help the 90% of individuals who experience low back pain get back to full recovery and not let the chronic pain take over their life.